Greetings, everybody. Welcome. This is the Tuesday, September 21st meeting of the Advisory Board of Health. We do have a quorum. The first order of business is on the website and provided to the group earlier were the minutes to our Q2 meeting. If you've had a chance to look at them, if there are any changes or objections, please let me know. But unless there are any changes, we will make that change that from draft to final. The first order of business is, and really only order of business because this is a special meeting, is the Health Director's report. So David, I'll hand it over to you.
Thank you, Kevin. Thanks all for being here. I thought we'd start off with a little staff update. We had a change in our part-time food service inspector, where Lori Romick, who's been with us for the past year, has retired, and we were fortunate enough to pick up another part-time inspector, Cedric Gu, who is actually lives in Norwalk, which works out well for us because he can come by in an emergency, which he's done a couple of times already. So our timing was very fortuitous in that regard. As part of one of the attachments that I sent out earlier was a rating form. I'm sorry I couldn't figure out how to bring these up on the on this format. But was a rating that we gave to Lori upon her departure, similar to our food service ratings, where we gave her an A for the work that she had done over the past year. She was fantastic. You know, we really have pretty much caught up due to her efforts and that of Cedric's with our food service inspections and our, you know, the mandated re-inspection timing. So we're in good shape with our inspections. It was interesting to also see how in the course of the past year, when we weren't doing as many physical inspections because of COVID, that a lot of our facilities, some stayed really good and some didn't. So there's a real value in that we found through our regular experience in maintaining a regular inspection schedule for most of our facilities, because they need to be reminded of certain things in food handling practices on a regular basis. So anyway, I want to publicly thank Lori for the work that she did. And she's still doing, by the way, she's agreed to stay on to do plan reviews for us for new facilities. And we've had 3 new facilities that either through renovation or new facilities coming in that she's been doing in the past couple of weeks. So Darien remains a desirable location for food service and business operations. The other thing I wanted to let folks know about is that we have a grant-filled position for a contact tracer. Rebecca Cabot has been working with us since July. It's one of the reasons why we're able to now, with our weekly reports, provide vaccine updates and some details on our breakthrough cases for COVID positives. She's fantastic. She's been right on top of this, and we're very fortunate to have her on board to help out. And of course, I can't say enough about the rest of our staff with Mindy and Michelle and Paula, our nurse. Paula has also submitted documentation to the State Health Department for our HeartSafe community designation. It's every 3 years we have to do that. And of course, we are in the forefront of HeartSafe activities and AED locations and training for our post-53 members, and just training in general, first aid training for HeartSafe related responsibilities. So we're working on that. And so I think that's future and services, current and future services. Kate had asked me to, or asked all department heads to provide an overview of what we do as each department, and also what our future plans are. And so I focused and submitted that to you for your review. Just kind of bullet pointed some of the things that we do on a regular basis. Food service protection and hair and nail inspections for salons, beaches and public pools, you know, all the things that we regularly do. And then looking towards the future. And I think that's something that I would like you folks to kind of give some thought to. You know, what do you see us doing as a health department in the future? And, you know, I gave a series of bullet points of what I think that we should be doing, but I'm looking for your input as well. And this is something that we could use as our planning over the next couple of years. I do want to follow up on our the health needs assessment that we did 5 years ago. It's 5 years now. So I want to follow up on some of those things and work on that. But I would appreciate if you could take a look at the suggestions and also provide some input on what you see this department doing as we go forward. And as you mentioned, Christine, in our earlier conversation, we do have to take into account climate and flooding. And, you know, these are things that, as you said, 50 years you never saw before. And, you know, we're starting to see things that we didn't have before. We're seeing new types of simple things as mosquitoes, ticks. You know, they weren't here before. You know, we're seeing different things that are going to impact our lives. And as a health department, I think that we need to pay attention to that.
And a lot more bold. Mm-hmm. Mm-hmm.
So I'm looking for, you know, your input on that. So with that, and with respect to future services, we can't overlook the issue of marijuana and the fact that the state health department has adopted regulations basically legalizing recreational use of marijuana. I had, as part of my role with this Connecticut Association of Health Directors, submitted or co-authored testimony basically opposing the legalization of marijuana, but also suggesting that if realizing the reality of the financial situation, that it probably would be approved, to recommend that if it is approved, that funds be set aside to provide for treatment and also counseling and educational programs. So, you know, I think that one of the things that we would look toward to do in the future is to provide some form of educational overview here in the community for marijuana and some resources for folks. I don't know if you want to talk any more about any of those topics at this point.
David, I have some ideas that I might, you know, toss your way, not necessarily at this meeting, but you know, I can certainly email you.
Okay.
Encourage the rest of the members to do so too.
Okay, great.
Well, I think currently the town has ordinances in place that, you know, there can be no sale of marijuana, there can be no growing, and that will conflict with the state rules that go into place. I think it's October 1st. So I don't know how that's going to play out, but I think planning and zoning is looking at that pretty soon.
Well, that would be a matter for town council to look at with respect to if there's a conflict between our local regulations and the state. But I do think that the regulations for marijuana do allow for communities to not allow the sale within their boundaries. So,
Right.
you know, that is something that I think we could do as a community should we choose to do it that way.
I'm also concerned about driving while impaired, you know, through town under the influence of marijuana. And then if they were pulled over, how would that be assessed? From my understanding, it's difficult. We don't have any tests at the point to say that this person was under the influence and driving unsafely. So how would we handle that? Do you know?
You're right. There is no test to determine if a person is impaired at the time, at any particular time. Marijuana stays in the bloodstream for a considerable period of time after it's either consumed or smoked or whatever. So, you know, it's not like alcohol that dissipates within a certain period of time. So it's really difficult for law enforcement to figure out if somebody is actually impaired. You know, so I guess that it really would depend on if that person was doing something erratically. You know, I mean, you know, they could get a ticket for, you know, if they're driving erratically or if they have an accident or something. But yeah, that wouldn't be part of the, couldn't be part of the charge at this point. And that's been one of the issues with the whole conversation about legalization is how do you do that from a motor vehicle standpoint, and how do you gauge that? But you know, I mean, part of the testimony that we gave against marijuana was, you know, we're fighting an opiate epidemic, we're fighting substance abuse problems, and you know, how do we? It seems kind of duplicitous for us to say, yeah, it's okay to, you know, marijuana is okay, but yet, you know, we're still fighting this other problem over here, you know, so, but then there's the issue of alcohol, and, you know, with our EMS response lines, you know, we're still consistently, and that's part of our health needs assessment findings were that we have higher response for alcohol-related overdoses, if you will, than we do for drug overdoses in this community. So, you know, and alcohol is perfectly legal for those over 21. Anyhow, lots to look at in the future. And oh, there was one other thing that we as a health department we're going to unveil soon, is to have our town hall emergency response team to have first aid training for people who work in town hall to be able to respond to emergencies within the building. And the other thing that I was hoping to be able to do is to have Narcan training as part of that, so that people in town hall will know how to respond if somebody comes in and has an emergency situation, short of having to call 911, so that we can have people on hand at all times that know how to respond to an emergency. That's something that, again, Paula has been working on with HR to get going. We hope to have that up and running in October. So that's, I'm sorry.
Curious to know if in town hall with that kind of training for first aid and for emergencies, does that also include the Mather Center where there may be a higher incidence of injury or falls or some kind of event?
Absolutely.
Okay, great. Thank you.
Absolutely. That's part of what our response would be. And we would also like to include the library in that.
Oh, good. Okay.
So that's kind of where we're at with the department, with staffing. I'm feeling pretty good. We're going to transition into the COVID update. And, as far as there's a whole bunch of uncertainty, as you all know, you watch the news. Boosters, who knows when that's going to happen. We only issued Moderna and Johnson & Johnson, and the only boosters that have been authorized so far are Pfizer. So we do have our local pharmacies that did issue Pfizer. So and people who are calling, and still there's still no decision made as to whether or not you can mix and match vaccines. The advice right now is to still stay with whatever you had the first time, you get the second time as a booster. So right now, the only boosters that are authorized are Pfizer. Our local pharmacies, as I started to say, like Greaves and, well, I'm not sure if Greaves, but I know Walgreens had Pfizer. And some of the surrounding CVS's and so on also had Pfizer. But we're going to be paying close attention to that. I reached out to our vaccinators who work so well at our volunteers as at our COVID clinics through the spring. And both the vaccinators and our screeners, for the most part, have said they'd be more than happy to come back and do an encore. It was great. It worked out wonderfully. As I said before, we did over 6,000 vaccinations in 40 clinics, pretty much manned by volunteers. So that group is ready to go again, but we don't know when and if we're going to get the go-ahead for that, for boosters.
David, who makes the decision to do that? Is that something the selectmen do, or is that under your department to go ahead with using town hall?
Well, using town hall is we already have the approval to use the town hall, to use the gym as needed. So, we've arranged for that. We have, and I'll mention it a little bit later, but we have 4 clinics scheduled in the gymnasium for seasonal flu shots. We were thinking at first that we would do combined COVID and seasonal flu clinics, but the booster shots haven't been approved yet. So we're just going to go ahead with our seasonal shots. They're going to be the Tuesdays in October. The schedule is online, and I also sent it to you. But it is posted on the health department website and the town website as to the schedule for our seasonal clinics. But we will be using town hall if we need to do booster shots again. As far as who authorizes and when it is determined that you can offer booster shots, right now the FDA made recommendations that the CDC needs to approve. So there's a process, and FDA made the recommendation that Pfizer's be okayed for those for booster shots, and those over 65 and those who have elevated health concerns. But actually opening it up for Johnson & Johnson and Moderna, they're still looking at the data. And, from a local perspective, I can tell you that what we've been seeing, again, through the efforts of our contact tracer, Rebecca, is that by and large, most of the breakthrough cases are occurring with Pfizer vaccine. So I'm not sure if that means the efficacy of Pfizer is a little less than the other two, or if more people in town got Pfizer vaccine, elsewhere beside coming to see us. So it's hard to say because we don't really know where they got vaccinated. We just know, based on our interviews, what vaccines people received. Most of the cases, positive cases that we're seeing these days, are breakthrough cases. If you look at that weekly report that I've circulated, you can see that our vaccination rates are incredible for those eligible in town. The key thing to note, again, I sent these earlier and they're online on our website, but I think it's really important to note that we have vaccination rates for those eligible in town to be vaccinated of 97% have had at least one dose, and just a hair under 90% are fully vaccinated of those eligible in town. That's incredible. And I did some research on that, and I believe I can safely say that leads the state in terms of the overall vaccination rate. The one consideration that I have to point out, though, is we have a very high percentage of our population that is ineligible because they're under 12 years old. So that kicks our overall percentage of those totally vaccinated to about 70%. Big difference, because our under 12 population is like 20% of our total population in town. So it makes a difference. But all the data indicate that vaccines keep people out of the hospital. They may test positive, and there may be breakthrough infections, and people may get symptoms, but they tend to be mild, and that's verified through our interviews. And we have, knock on wood, have not had hospitalizations. We haven't had any significant outbreaks in our assisted living facilities. So, you know, we're in, I think, really good shape. The other thing I want to mention about COVID and the community, we were all very concerned. When I say all, Dr. Adley, superintendent of schools, the medical advisor, Dr. Kennebec, you know, and I, all of us who are working with the schools, very concerned about what would the outcome be and what will happen with the unvaccinated kids in school when school opens. So far, so good is my report on that. So far, so good. We're looking really good. We haven't had any outbreaks to speak of. We've had a couple. There was a couple classes, I believe, that were sent home last week. And that was because the teachers were unable to ascertain whether or not social distancing was being maintained. The idea being that if we can ensure that people are staying 3 feet during the course of the day, the only people that would need to be quarantined in the event of a positive case would be those that were within that 3 foot separating distance for 15 minutes or more. But unless the teachers are able to verify that, then we can't be sure, and the class needs to be quarantined. We've worked closely with the schools through the past year and continue to do so on a basically daily basis when issues come up. We are holding steady in terms of our caseload. It hasn't spiked, and you know, we hope that be the case, because we were concerned on the impact of school reopening on our caseload. We continue to be busy with our drive-through test facility. They're operating 7 days a week. We have made an arrangement with them to provide for a reduced rate for town employees. But with that, I'll take any questions about COVID right now, if anybody has any.
So at this point, the hospitals aren't like, you know, stressing for beds or anything like that. They're pretty open.
Yep.
Basically.
Yeah, we're doing well. We're doing very well. That was one of the, you know, we participate regularly with conference calls with the state, and the state epidemiologist yesterday on the call with the, what was this morning? It's this morning. with the State Department of Education. Connecticut is second in the country, in terms of the rate, the positivity rate, second lowest. Only Maryland has a lower rate of COVID positivity than Connecticut does. And that's also related to hospitalization. It's very low. And again, that the actual consideration is that's reflective of the effectiveness of the vaccines. So vaccines are keeping people out of the hospital. The states that have the highest vaccination rates are having the lowest hospitalization rates. The direct correlation. Doesn't necessarily mean that people aren't going to get positive, aren't going to have a breakthrough case, but the chances are, if they do, it's going to be less serious.
Is there anything that could be said about the kids who are not eligible for a vaccine, the impact to them in general relative to adults? Will they be more resistant, or will it impact them less if they get COVID-19?
I'm not sure I understood the question. Could you repeat that, please?
Well, what I'm wondering is, since children under 12 and under are not vaccinated, there's a likelihood that they're going to get the virus. So in terms of impact, are they just as likely or less likely to fall as ill as adults, or are they more resistant to it?
The state database is showing that while there are increased cases in ours also show that we're having a pretty fair number of positive cases in the age group. Actually, that age, the under 12 age group, if you look at our weekly charts, is the number one kind of category for positive cases. Our interviews are showing that the kids have like cold-like symptoms. The state epidemiologist, addressed that question about the severity of hospitalization, and he said, while there are some hospitalizations of this age group, the numbers are still low.
Okay.
So at this point, I don't think it's certainly nothing to be alarmed about. I mean, DPH is encouraged that while there's cases, they don't seem to be particularly severe at this point to, have widespread hospitalizations of kids.
Okay, thank you.
You're welcome. Let's hope it stays that way. So right now it's looking like I'm still going through our weekly report. It's still being reported that basically 100% of the cases being reported now are the Delta variant. The original COVID-19 virus isn't even found anymore. It's all the variant. But fortunately, it looks like we're still having vaccine effectiveness against the variant. So, any other COVID-related questions, concerns, or suggestions? As I said, we'll be ready to run booster clinics. We have basically staff standing by. We have the supplies. We have the facility. We don't have vaccine. The state is saying don't order vaccine until the boosters are authorized. So we're not. I'm confident that we we had such success doing it when we didn't know what we were doing the first time around, that we can do it this time when we have a pretty good idea of what needs to be done and how to do it. Okay. All right, so seasonal flu clinic schedule. As I said, Tuesdays in October. I don't know if you want to make notes of this, but so all Tuesdays, the first and third Tuesday are going to be from 10 a.m. to 12:30. And the second and third Tuesday from 2 to 4:30. We will have those online. And we'll be having a separate, on one of those days, and I don't, well, it's not written here, but we will be having we will be adding hours to one of those days for town hall employees, as well as our vaccine volunteers, library folks, EMS, fire. So we'll be adding an afternoon or on one of those days to take care of those folks. Questions, comments? Okay. Food protection program status. As I said to you earlier, we've had a change in staff. We're fortunate to have Cedric from Norwalk join us, who is local, so he could respond to emergencies, which he has. I don't think he realized what he was buying into when he's retired. I don't think he realized what he was buying into, but he's been great. I mean, he went to the event on Saturday night that was down at Tilly Pond also, because we do inspect the temporary events that go on in the community. But he went through several of our places and did some work with flooding. And I really want to kind of highlight what he did in one of the facilities. In one place that lost power, more than one place lost power, but one decided he was going to take care of the situation by bringing in dry ice to keep his walk-in boxes down the basement at temperature so he wouldn't lose his food. So we knew that he was without power, so Cedric went down the basement to check it, opened up the walk-in box and was nearly overcome with the fumes coming out of the box from the carbon dioxide. So he got in touch with me right away. We got in touch with the fire marshal, who went over there, did some meter readings, and found that the basement level was toxic. The oxygen levels were below life-sustaining levels. And if they spend any period of time there, or if staff had spent any time down in the basement, they could have been overcome. And so immediately they had to bring in some specialization people to kind of ventilate the facility. But here you have an example of somebody who's trying to be proactive and take care of the situation. And, you know, one of the things that we always say is, you know, get dry ice if you're without power. So he got a lot of dry ice. And unfortunately, the unintended consequence of that was he created a hazardous situation within his facility. Unfortunately, because of the timing of Cedric going there on that particular day, I think we averted what could have been, you know, a disaster, a real disaster, you know, and potential loss of life. So hats off to Cedric. I gave him an award, you know, the A for the day kind of thing. We also, and I'm pleased to report that we really are caught up in our inspections. It's been a chore to do that. But as I said before, some of the facilities really stayed on top of things, and some didn't. But we've been working with everybody from both ends of the spectrum. Beach water sampling. Because of the storms that we had this year, the two of them, one in July and the one in August, was the first time that we've ever closed the beaches for 2 consecutive days. It's the first time that the State Department of Energy and Environmental Protection recommended extended closures of water bodies. Both times we had fairly extensive impact of our streams and waterways by overflowing sewer systems, which is to be expected every time it floods. You know, the sewer lines can only handle so much water. And so we did close the beaches for 2 days each time. But other than that, all our water sampling from Memorial Day through Labor Day, beach water was fine. And just as a reminder, we do maintain a hotline that is time sensitive. And if there's ever a time when we get more than an inch of water, we notify Parks and Rec. And we also will put a notice on the hotline that the beaches will be closed for at least the day. And then, as I mentioned, this time we had beaches closed for 2 days. But soon after that, you know, as soon as we went back after that to retest, the water was fine. So it doesn't take long with the types of currents that we have and the tidal changes and the salt water to, you know, result in us having bacteriologically safe water. So we're very fortunate in that regard. I mentioned the flooding, and I mentioned the long-term planning for climate change. That's a very real thing for us. We had several establishments, a couple of which are still not really fully open, that have to rebuild because of the sustained flooding that they had. We've been working with them to try to, in a couple of cases, at least let them get by serving coffee and, you know, kind of miscellaneous things, sort of like in a kiosk basis. And we have couple places that really have to rebuild. So not even sure, they weren't sure if they were going to, because, you know, when you get flooded twice in a month to that level, you got to wonder, you know, how many more times can I sustain this? And then when you have to buy new equipment and rebuild, because, you know, the walls get wet, the sheetrock gets wet, you know, you can't, it doesn't just go away. You have to tear it out and rebuild it. So it's a challenge, and it's a challenge for food service operations and certainly homeowners as well. Several of whom have really, as Andy said, you know, flooding has occurred in places, and Christine, you know, you said it, you know, it's happened in places that you never saw before, to the degree that you never saw before.
David, the pictures I saw of Stop and Shop were incredible. Did you have to do an inspection there?
Millions of dollars, literally. They threw out. You know, Mindy has the tally sheet, and I count the number of roll-off dumpsters that they filled with product. That, you know, and it's just awful. Yes, we were there, and, you know, we had conversations with them before they reopened, and did, you know, as we did with each facility that had the flooding problems, we've you know, wanted to go through and make sure that adequate sanitization took place, and, you know, products were removed as needed, and you know, restocked appropriately. But yeah, that was incredible. The mess there, terrible. Millions of dollars, as I said. Mosquitoes and ticks, as I said, you know, we had early on, back in July, we had our positive West Nile pool of mosquitoes discovered, which happens every year. And knock on wood, we still haven't had a positive case in town in humans. We still are submitting ticks to the Connecticut Agricultural Experiment Station. When COVID came along, we've managed to enable folks to submit the ticks themselves. So they don't have to bring them to our office any longer. You can download the form online and put the tick in a little plastic baggie and mail it off to the Connecticut Ag Station, and we get the results, and so do the people who submit them. And if people have any questions about their test results, they can contact us and we'll help them out. You know, there's still about 30% of the ticks that are submitted are positive for Lyme and other diseases. We're seeing other diseases coming to be tested more prevalent. But you know, it's all about tick avoidance and making sure that when you come inside that you check yourself very carefully, make sure you don't have any ticks, and because for the most part, if you get them off quickly before they've had a chance to be engorged, you're okay. You won't get sick, even if there's a positive tick. Moving on. Cosmetology salons, this is the month where we do the re-upping of permits. Annual permit renewal is now. We've had a few new places come in over the past couple of years. Again, Darien is a desirable location. People want to look good, and this is a place to do that. We do inspections of those facilities twice a year. That's our goal for that. We do inspect them. The inspection results are posted online, just as, of course, our restaurant inspections are and ratings. So people can see what their favorite salon has as an inspection result, as well as, again, the restaurants. And finally, planned public outreach. Next Wednesday, we'll be having a booth at the farmers market. I'm sure we'll be answering questions on COVID. Then our nurse Paula will be there doing blood pressure checks. Be providing literature as we can, you know, what health department does, try to do outreach, again, you know, letting people know we're here, and basically what we do. I've had conversations with Jim Cameron about doing interviews, timely interviews online about COVID. And, you know, we say we're going to do it. It's just a matter of doing it. So that's coming up. I want to coordinate it, however, to do it with our medical advisor, because I think it's important to have him be there along with myself. So that's coming up. And as I mentioned earlier, I think that we're going to be planning to do some programs at the library, probably having to do with marijuana, vaping. I think will be the topics of most interest initially. So with that, that's my report for the evening, folks. If you have any questions, please feel free.
My only question, David, is it okay to grab some of your content that you sent us, and I want to forward that to my Public Health and Safety Committee?
Any and all of it is okay.
Okay, great. Thank you.
You're welcome.
Yeah, and with all the flooding, are we going to talk to people or inform them about mold and mold mitigation? that may happen after this kind of flood?
Well, you know, I've been putting, we have a series of articles on our website about that. I've been tweeting that, you know, what guidance for if you've been flooded, what to do. And certainly if anybody contacts us with respect to concerns about mold, we will provide information to them.
Yeah, maybe something too to bring up when you go to the farmer's market might be good if we have a handout or something on that, might be useful for some people.
I think that's a great idea. We'll do that.
Okay, thank you.
Thank you. Yeah, the other thing that we've done, we had a pamphlet that we had developed a couple of years back on what to do in terms of flooding and power outage. So we'll bring that too, you know, because that has relevance, you know, with respect to, you know, food in the refrigerator, you know, and, you know, power outages. And so we will do that. The other thing that we had done that we upgraded, and I'll circulate to you folks, which I haven't done yet, is we have a pamphlet format for the what the health department does, basically. And we upgraded that, and I updated that with the intent being having that go to the newly elected Board of Selectmen, and Kate thought that was a little bit more than what she wanted to submit to the Board of Selectmen. But I'll circulate that to you tomorrow, so you can have that to look at as well. It's updated. But yeah, thank you for the idea of the mold handout for the market. Other comments or suggestions, folks?
And the other thing is that people have been noticing it, and I don't know, I know it will affect your garden and crops, is about the spotted lantern moths that people are starting to see around here. And I know the EPA has said if you ever see one of these to kill it, because they'll cause such great destruction. And I was reading in Stamford, somebody had like hundreds of moths, so spotted lantern moths. So it would just be like a matter of time before they're here even more. And I don't know, from my understanding, they don't really cause human disease, but they may affect what people are growing in the environment that way, trees and plants and everything else that we're trying to save.
Yeah, the state, the Agricultural Experiment Station is just such an unbelievably great resource. And, you know, of course, that's who we utilize for doing our tick testing, and that's who does the mosquito monitoring. And they are all over the spotted lantern moth issue. So, you know, I think that might be another thing that we could bring to the table at the farmers market.
Yeah, especially the farmers market where they go after agricultural crops. Yeah.
Exactly. So yeah, we'll do that. Good idea. I'll download because I'm sure that the experiment station has information sheets specific to that.
Yeah, they're great. Mm-hmm.
Yep, they are.
I know, they're right by where I work.
Yeah, you know, it's one of the flagship activities that the state government does is the ag station. It's really, they're terrific.
Anything else, gang? Any other questions or comments? Unfortunately, because it's a public meeting, we can't add any additional items to the agenda, but we can ask questions about that. David, maybe we'll hook up next week and talk about the long-term planning for the department. If nothing else, our next meeting is scheduled for Tuesday, the 14th of December at 5 p.m. as it comes closer, we'll send a reminder. But just if following the regular cadence of schedule, it's Tuesday, the 14th, 5 p.m. and unknown if we'll be in person or virtual, but we'll be in touch closer. David, thank you very much for your time. Group, thank you. We have a very unfortunate vacancy in the among us. So if you guys know of or can think of anybody who might be interested in joining us, that would be great. Otherwise, we will speak to you soon. Be safe and healthy, everybody.
All right. Well, thanks, everyone. Good night.
Thanks, everyone. Good night.
Thank you.